generation is going through a different patches, and that is being inflicted by our adults, those people who have become those who have lived the childhood, and now they are the actually people who are actually inflicting those uh, problems to the children. So now the idea is to how, as a very, very organized effort, we are going to resolve this issue. Can we design, we take with some fundamental decisions where we can help the Department of Women and Child of the Government of India, and also that the respective state government, where they can take decisions and take this agenda forward along with all the partners, educational institutions, social society, faith-based groups, civil society, NGO, INGOs. So all alone it cannot be handled. So we thought that yes, we should have a partnership, and it's not consider only children as a victims of the circumstances, but we also try to look at them as a potential leader for the future as well. So how that could be provided. So I would suggest that all the deliberations, I'm sure that all the distinguished panelists who are here, they know very much now, because the psychosocial stress is very much high on the children, especially COVID-19. They have not been able to dissipate their energy in a positive way. They are confining, and they are also getting the brunt of the COVID-19 differently. So distinguished panelists would, I'm sure they would focus these issues and will be able to help us in giving us some framework which we can carry forward for the future. So once again, I convey my heartfelt thanks to the partner and all the distinguished panelists and all the distinguished participants who have joined. On behalf of Major General Manoj Kumar Bindal, who is the Executive Director of NITM, my own personal behalf, I am heading this child-centric disaster risk reduction. And also to all the team members of mine and yours who are actually making this happen, our partnership building. So thank you very much. And I am very much hopeful for the thank you.
Thank you so much,
Professor Santosh. Sir. It's a kind information for all. This child-centric disaster risk reduction center is a brainchild of Professor Santosh Kumar sir, and the center is functioning under the leadership of Professor Santosh sir. Thank you so much, sir, for sharing the background of CCDRR center and setting up an agenda. Now, we will be moving to the presentation. It's my privilege to invite Mr. Sonikuti Charge. He is the Child Protection Specialist in the Hyderabad Field Office of UNICEF for the last 10 years. Prior to this, he worked as Child Protection Specialist in UNICEF Delhi office for 5 years. Mr. Soni has extensive experience in the field of child rights. He has worked extensively on child protection issues, child labor, child trafficking, juvenile justice system, children in different circumstances. He was part of the drafting committees of juvenile justice, central model rules, and the integrated child protection scheme for the Government of India. We welcome you, sir, and over to you, sir, please. I think now he has a problem. Dr. Surendra, am I audible to you? Dr. Surendra?
Yes, sir.
Okay, yes, I think we lost.
No problem, sir. No problem.
None. Mr. Soni has lost his connection. Let me try.
No problem, sir. No problem.
Sir. Thank you, sir. Thank you so much.
Dr. Veena Pillai, are you available? Dr. Veena?
Yes, yes, sir.
Balu sir, please wait, sir. Balu sir?
Yeah, sure.
Yes, sir, please wait.
Sure, we'll wait for.
Dear friends, as you all know, that keynote address is called as the essence of any kind of webinar. So it's now time for us to pay attention to our keynote speaker, and it is indeed an honor for us to introduce you a distinguished personality who is our keynote speaker for this one-day national webinar. So at first, let me introduce a very eminent personality who is the keynote speaker of this one-day national level webinar. Yes, she is Professor Swati Chate Karad. Professor Swati Karad is the daughter of the visionary and eminent educationist, Dr. Vishwanath Karad sir. He has made his vision as her mission to create knowledge hub, which has the essence of spirituality in every aspect of child development. At present, she is holding the following responsibilities in realizing the vision of her father, Professor Dr. Vishwanath Karad sir. She is trustee and secretary general of Miles Trust. She is an executive director at Miles MHA Group of Institutions, Pune. She is member of management committee for MIT Group of Institutions, Pune. 72 plus multidisciplinary educational institutes are running under her guidance. She's the member of Board of Management, Dr. Vishwanath Karad World Peace University, Kothurud, Pune. She's member of Board of Management, MIT Art Design and Technology University, Rajbagh, Loni Kalbhur, Pune. She is executive chairman to the entire school division, approximately 25 K-12 schools, teacher training institutes, MIT School of Education and Research. She is working upon expansion and establishment of new KG to PG educational institutions under the trust and actively involved in establishing professional universities in various parts of India. Her aspiration to contribute something worthwhile to the society has led her to take up the position of a convener to support your father in all CSR and spiritual activities conducted under World Peace Center. Recently, in October 2015, she accompanied her father, Professor Dr. Vishwanath Karad sir, to 9 Parliament of World Religions held at Salt Lake City, Utah, USA. She's actually involved in women empowerment programs and skill development programs under Miles Trust and supporting many other organizations involved in empowerment of rural women. Dear friends, Professor Swati Chate, Karad ma'am possesses such a glittering and outstanding set of achievements. We are really very lucky to have such a great keynote speaker for today's national webinar. So now, may I request Professor Swati Chate ma'am, today's keynote speaker, to present her keynote address and guide all of us. Over to you, Professor Swati Chate Karad ma'am.
Thank you, Sanjay ji, for your kind words. I hope I am audible to everyone.
Yes, sir.
This webinar about protecting children from violence, exploitation, and abuse, I feel a very sensitive topic, and I must thank the National Institute of Disaster Management, the Executive Director, Honorable Shri Major General Manoj Bindalji, then Professor Santosh Kumarji, Head CCDRR NIDM, and our own institution, Miles MIT, the B.Ed College of ours at Alandi, all the organizers for thinking about this webinar, for creating the awareness about how do we protect our children from abuse and violence. I think this is very much needed, and every sector of society needs to look at this problem and address it in their own way. All the dignitaries today who are present, Mr. George from UNICEF, Dr. Suresh Kumarji, who's just from the American College, Dr. Kumar Raka, Dr. Surendra Helkar, Dr. Balu, Dr. Sanjay Shinde, Dr. Veena Pillai, and many other dignitaries who are there, and all the audience, all the dear friends audience. Very good afternoon to all of you. Friends, I think the first and the foremost thing is our children. They are our future, the future of the entire world. And we, the grown-ups, we have this responsibility to create a very healthy and safe environment for our children, who in turn will grow up into very healthy and happy individuals, and they will create a healthier and happier and safer environment for the future generations. And this shall go on. I think a very huge responsibility lies on us in this sense. And many institutions like today in IDM, Dr. Santosh Kumarji just shared with us the National Institute of Disaster Management, CCDRR, from Government of India, at the global level, the UNICEF, and many other institutions. Every country's government is striving hard to address this issue with the children, their abuse, the violence, the exploitation of the children. Many NGOs are trying, many individuals at their own level also are doing a lot of things to address this issue. And I feel it's bringing a little positive change in this context. There are different platforms that are being created, like the student parliaments, the children parliament, the school sansad, which are giving opportunities to the children to speak their mind, to speak about their problems. But still, there is much more which is needed to be done, and many more of us need to come forward and create an awareness amongst the society about this very concern that we have across the world, rather, because we are living in a very huge world with a massive population, and so there are vast number of challenges, and we have to like Dr. Suresh sorry the Sanjay ji, I think he said that how when a disaster happens, how the children get affected, because they lose their families and then the consequences happen. So this problem is really very vast. So many more people like us, we need to come forward and do some positive change in this, and create that awareness and extend the helping hand to all those children who are facing this kind of abuse. And here I feel that being in the education field, I believe that we at the educational institutions, we do have a major role to play. And I'm really happy that today MIT has got this opportunity to get associated with National Institution of Disaster Management, Government of India, and at least start conversations and think of possible solutions to these problems. And we will be very keen and happy to extend our hand in this very noble cause. And this is very much required. And I feel it's our responsibility being an educational institution. As I said, educational institutions have got a larger role to play in this respect. Friends, when we fall sick, I think the allopathic medicine we take. The allopathy medicine, what it does, it addresses your sickness and your illness. It cures your illness. So the allopathy, they try to understand the symptoms and give the medicines. But when we look at Ayurveda, Ayurveda gives us a, lifestyle changes. It gives us a way of life. And in that sense, it's kind of, addresses the root cause. With that, it gives you a lifestyle which will help you protect from getting sick, getting ill. Similarly, I believe this very problem, although today, right now, there is existence of violence and abuse and exploitation of children, for that we definitely need very strong and solid solutions. But to eradicate this very problem from the root, we have to get to the root cause of it. I'm speaking from the educational thought process, that how do we really address this? We have to get to the root cause of it. Anybody who faces a violence, or the person who becomes violent, a person who becomes abusive and troubles others, why does that happen? What is the reason making somebody violent? I think it's the mental health of that person. And what really nurtures the mental health? If we look at the very, broadly, the family background wherein you are born, the family structure, your economical background, your education, the societal impact, there are many other factors which are developing your mental health. So for that, I believe, how do we really address this and make sure that every individual is healthy in the mental sense? They're happy and healthy. And here comes, I think, the role of the educational institutions. As I said, when we say the societal impact, today we see that in India, if we speak about India, we have always had this joint family system. Now there are more nuclear families. The the percentage of divorce is going up. That is causing the families to disintegrate. And that makes the children more vulnerable towards violence, abuse from their own parents also. Friends, you all know that typically children face violence, abuse, or exploitation from the people whom they trust the most. So it's the family, it's the parent, it's the teachers in the schools. And that's why I think the educational institutions, how they can really bring this change in the overall society in a longer run. This is not an immediate solution, but definitely if we work on this in a longer run, we can bring that change in the mindset of the people who become violent, who become abusive. So typically in a school, if we provide like if we have some kind of a activity in the school where the teachers, if few teachers or employees are becoming abusive or violent against the children, can we have some kind of a platform for such people, such employees, wherein they can express their mind, and we can help them out, because they come from a family where there is some kind of a destruction, and that makes them violent probably towards the children in the school. So if those kind of employees are being heard, they are being counseled, probably they can come out of their problem and become more children friendly. Similarly, we can have certain activities in the schools. I'm talking about the schools specifically, for the children who are facing some kind of abuse back home. If we have some kind of activity in the school wherein we create a platform and make that child feel, express what they are facing back home, and probably those parents can be called and counseled. See, in this manner, if in the schools we do certain kind of things, and we can help at least the children who are coming to our school get out of this kind of a violence and abuse by addressing the mental health issues of the teachers, of the employees, and as well as the students. Apart from this, I feel our educational system today is more about marks and ranks, and we have more keenness towards mathematics and science. Of course that is needed, maths and science, but if we really are thinking of having a good mental health, I think subjects like humanities, social sciences, art and craft, performing art, which these subjects really help to develop the mind. And I feel, because in MIT we always had believed that spirituality definitely plays a very big role in this aspect. And if we can, it may be any board that we are running in the school, it can be any curriculum that we are running, but we can surely do this kind of things to bring this change and create a healthy environment and make the individuals with a healthy mind. And that's why I feel that these subjects needs to be given more emphasis on in the educational system by every educational organization in the country and in the world rather. empathy, I think empathy is the one value, if we could really inculcate through different activities. Our whole educational activity should be, evolved, or it should be revolving around empathy. A person who is empathetic definitely thinks twice before hurting somebody. So this can really help us in developing a very healthy mindset. Apart from this, I think these awareness programs, which are going to help people having more stress due to their work, due to having nuclear families, that can be addressed through all these, whatever I said just now. And we at MIT, I think the institutions like us should definitely thrive and create this awareness and make our employees and the students also aware of it. And we will be very much happy to join hands and constructively and do certain things in the coming future. So I'm really thankful to the organizers for taking up this topic and associating with us and giving this opportunity. So I will urge all the teachers to think about it, who are there in today's audience, and definitely practice this so that we make this world a better place for our children who are our future. And this cycle will go on. These children will become very healthy and happy human beings, and we know Bhutan and Japan, if we look at these countries, why they have a better happiness quotient. What does that mean? Because their family systems are having that kind of a thing. So I think we can also, every country can do that, and I'm sure they can bring. I am really thankful to all of you. Thank you very much.
Thank you so much, Professor Swati Chate Karadman. It was really an outstanding keynote address. Dear friends, I'm very sure that you agree with me when I said that ma'am's speech or ma'am's keynote address will be an insightful, knowledge-filled keynote speech. Ma'am has given various examples. She has not only given examples, but also given us solutions for this problem. And she has told that spiritual values are very, very important and how we are going to implement it in Midas and mighty group of institutions. So thank you so much, ma'am, for guiding us, for enlightening us. Now, may I hand over this virtual online stage to the coordinator of this national online webinar, Dr. Balu sir. Over to you, Dr. Balu sir.
Thank you, Dr. Sanjay Sinde. It's a time to invite Mr. Sonikuti Charge, who is the child protection specialist in the Hyderabad field office of UNICEF for the past 10 years. Prior to this, he worked as child protection specialist in UNICEF Delhi office for 5 years. And Mr. Soni has extensive experience in the field of child rights. He has worked extensively on child protection issues, child labor, child trafficking, juvenile justice system, children in difficult circumstances. With this brief introduction, I handing over to Mr. Soni sir. Sir, I have assigned a role of presenter now. You can share your PPT if you want.
Yeah. Thank you, thank you so much, Dr. Balu. And it was so heartening to listen to Dr. Santosh and Dr. Swati, for example. I mean, I remember 2 decades ago, I was in MIT talking about human rights, and the commitment of the Institute to promoting human rights and child rights is something which I think will go a long way to really making the rights of children a reality in this country. And thank you for being the host and making this happen with MIT. It's my pleasure to be on a platform where MITians are around and to be talking about this very important dimension of child protection. And when I was listening to Dr. Santosh about what happened in Nepal and what is the impact of that kind of disaster today here in Bangalore, I'm right now in Bangalore. I know of 7 children from Nepal who are from the disaster affected areas who are doing hotel management training. We have facilitated that online program. It is continuing from then till now. So the impact of a disaster on children is, as Dr. Santosh was saying, much beyond our comprehension. It just does not get solved in a minute or two. And it is in this context that we are looking at how do we really look at the whole dimension of child protection, and abuse, exploitation, and neglect of children is something that is very important, and we really need to be addressing these issues. And as UNICEF is been a key organization looking at this, I'm happy to be in this platform, bringing the issues of protecting children from violence, exploitation, and neglect. And I think the title of is also talking about the whole Prime Minister's 10-point agenda on disaster, and we are talking about agenda number 8, which is on building on local capacity and initiative. And I think the response of local capacity and initiative is something which, for example, MIT is doing right now. In the context of dealing with disasters, in the context of dealing with issues of child protection, we need an intervention which is localized and not just at the national level, at NIDM level or CC, DRR, Center for Child-Centric Disaster Risk Reduction work, or anything of that sort. I'll just start with an anecdotal experience that I have 2 months ago. This is the experience of a ram who was rescued in the railway station by the from the child line, and the child was actually being trafficked, and the family, which was facing the brunt of the current pandemic and the situations arising, was forced to let this child off to a person who said he will take care of the child. And I think Ram is not just a case, it's not just an example, but it is a reality of thousands of children in India today. And it is, this pandemic has left many children homeless as child laborers, being trafficked, being married off, being vulnerable to abuse, exploitation, and neglect. And it is in this context that we really look at what is the impact on child protection. When I say child protection, the whole abuse, exploitation, and neglect children needs to be protected from these. And actually, there is one more which is not listed there, that is unnecessary separation from families, also is a child protection issue. And the whole word child protection comes from the Convention on the Rights of the Child. Convention on the Rights of the Child talks about what needs to be done for children to grow to their full potential, to live with dignity, and to be not discriminated, to do things in the best interest of the child. Therefore, those which are necessary for survival, their physical growth, the health, immunization, nutrition, things that are there for their growth, things that are necessary for their development, education, leisure, play, everything comes under child rights. And I think the whole protection, Dr. Santosh was talking about right of participation, the space for adolescent, the space for youngsters to talk for themselves, and that space is critical. So that is the right to participation. And right to protection is to be protected from abuse, exploitation, neglect, and unnecessary suppression. So we just look at what is happening in the realm, what is happened because of the what happens because of a disaster in the lives of children. You see, any disaster, and the current pandemic, for example, has increased poverty. And as an education institution, MITians would really know how many increased poverty, dropout, and the kind of distress that is happening in the communities in the rural areas. And I think it is from that context of those vulnerabilities. What is the increasing in these vulnerabilities, and what has happened as a result of that is the increase in violence, increased demand for institutionalizing children to be admitted out of home and being trafficked. There is negative coping mechanisms which is emerging, like what I said about trafficking, about child labor, child marriage, and unsafe migration. So basically, the impact of a disaster on children per se is actually increased disaster and mental health issues, distress and mental health issues. There is the children who come without parental care. There is increase in violence. There is increase in child labor and child marriage. So what actually the child protection challenges is like, parenting of adolescents, like, what is it? How do you really look at it in terms of adolescents? How do you really look at online safety? The current pandemic is something which is made everything to go online. 20 years ago, if I was in MIT in person, today I'm interacting with MITians on the online platform. Things have changed. Classes are happening online, education is happening online. And I think Dr. Swati was talking about the psychosocial mental health support and the whole challenge, not only from point of view what the child goes through as a stress, but even those who are perpetrator of violence is also issues of mental health. Therefore, the whole issue of psychosocial support, children without family care, violence, child labor, everything. So this is overall impact. And I mean, quickly, if you really look at what happened during the pandemic, it's like, we see that there has been an increase in the number of violence, the number of calls that is heard, and mental health and psychosocial distress. We are hearing every day about the student suicides, the children who are suiciding, not only at our levels, but across the country, from rural areas, from urban areas, from across, we are seeing children who are committing suicide, ending their life because they are not able to cope with this stress and strain that is coming up. And I don't need to give you details about more child labor and trafficking that is happening. Children on the move, we really saw the numbers which were like, the number of children were like, 5% of the families that migrated back from their villages were all children. And you must know that 20% of those children were child laborers. And what we are saying is the impact of a disaster, the impact is so great that it's actually a lot of children are forced, were actually sent back from childcare institutions back into their homes. And what has happened to these children? When children have come back, there has been an increased pressure for child marriage and child labor because the children came back from institutions, from hostels, and there is an increase in child marriage and so the constrained spaces in the homes, children being around, there has been increased violence. And being in close proximity, there has been a lot of cases of child abuse and sexual exploitations which is being reported. So what is seen, the overall impact of any disaster, and this disaster in particular, has been that there is an aggravated situations of child labor, child marriage, violence on children, and abuse, exploitation, and trafficking, and children being made to run away from homes. And therefore, the overall impact, though, for example, if you take COVID, it came as a very specific health crisis. But if you really look at what turned out to be is one of the biggest nightmares for children that happened as an impact of the pandemic. It is no more a health pandemic. It is turned the world upside down. The situations of children from 1 year of loss of classes, they've been forced to be at home. They've been like not able to express themselves, not been able to pleasure, games, play, leisure. Everything has been affected so severely that the mental health issues have increased manifold, and the kind of calls that come to Childline and others are a clear example of that. Now, it is like, if you see this, is what is the kind of a response that is possible? I think I'll just go into three three areas of what are the challenges. The challenges, I think, the most vulnerable children have been the ones most out of reach. When you're talking about child protection, if you're talking about the child who is abused, who is neglected, and who is being exploited, they have been the most out of reach. And they are not in our digital communication. There has been digital exclusion for the most poor and vulnerable, and this has been a consistent challenge that existed. And added to this, as Dr. Santosh was saying, the whole challenge of dealing with disasters and seeing the whole issue of child protection and violence, you will see that it is left to the WCD, the Ministry of Women and Child Development, or the department to deal with it. And what is happening is the resources there are crunching. This is actually, I always used to tell when I'm interacting with administrators, I ask them, if you're in RDPR, you have 98% regular staff and 2% consultants or people who are hired. Education, the same. And everywhere the ratio is less than, 85 to 100% are regular staff and 15% is consultant. In WCD, what happens is you have 95% are people who are on contractual job for 5-year periods and outsourced people. The whole child protection system in this country is managed by people who have been at that level. So the whole question is, how do we really look at these ones and move forward and make a change? So those are the challenges there. And then we have the mixed bag, it's basically the first respondent group. It's it's never been the first respondent group, children and child protection, never. The whole issue of emerging opportunities are the focus on psychosocial support. The fact that we are talking about mental health and psychosocial support is critical, and it is really giving us the opportunity of building on local capacity and initiative. Prime Minister's 10-point agenda on disaster risk reduction, point 8 is building on local capacity and initiative, exactly what we are doing. This opportunity of talking about child protection and issues of child rights is emerging as an area. So I will not get into the details of each of these, but I think ending violence, for example, work with the child line, the police, how do we really work with National Institute of Mental Health? How do we really look at MIT as a possible support system where we really look at strengthening the mental health support systems at the grassroots level? How do we really use the NSS, NCC, the adolescent or the youth volunteers effectively is a challenge before us. And when we really look at what happens in alternative care, the number of children who went back to families from childcare institutions, and it is how do we really give them local initiatives, local support systems in the family and communities. And on child marriage, child labor, I think we have experience from across the globe. Maharashtra, we have umpteen number of examples how children on the move have been reached out to, supported. And across the globe, across the country, we have many things, initiatives that happened in terms of reaching out to such children. And looking at the whole aspect of child marriage and child labor, I think it calls for really working together. And I think if you really look at what is it that we can do as a state responsibility or building local capacities and initiatives, the most important thing that we can do is to establish plans to strengthen district and sub-district level workforce and to focus functionality of services. The whole thing we are talking about in emergencies, how do we really reach out, and what is the advantage of an education institution like MIT? The reach, we can actually reach to district, sub-district levels using the student force, using the NCC, NSS, and other mechanisms. And so we have an action that can happen, and we can advocate with the state for concerted action. And child protection management information system, how do we really lead research and create data is something that actually I'm so happy to hear Swati ma'am talk about the necessity for humanities and how do we really make sure that more students come to humanities and make these kind of management information systems. How do we create that database which will necessarily give us the right kind of platform for action? And when we really look at the contextualized ending violence against children agenda, end violence against children agenda, we need to actually agree on the priority. Are we really looking at the child marriage or child trafficking or child labor or any issue? And we really need to be able to push these, make these studies as part of the humanities departments and use that as for our advocacy. And I don't want to say already the mental health and psychosocial support, MHPS's dimension was already touched upon in the keynote address. And this is one area where we need the health sector and education and everybody to be really working at. And I think the whole strengthening of the systems, which are family strengthening programs, the sponsorship and social protection benefits, which is like, reaching out to the vulnerable through mechanisms, and how do we really look at this? And I think to really look at is what is the priorities building local capacities and what are the areas we need to really look at it. And when we really look at the whole dimension of poverty, increasing of poverty and dropping out in schools, that it needs to be something that is from social protection point of view, the RDPR, how we are looking at rural development and Panchayati Raj department and interventions to make sure that we address the poverty issues. How do we really look at the school dropout system and what is happening to children who are leaving school? How do we work on that, the education department? And distress, violence, and mental health are areas which needs a coordination with the work with the health department. And how do we make sure that the response cannot be just by the child protection workers? It needs to be by health, education, and RDPR and others who really need to be coming together and working on it. And specifically, let's look at how do we priorities for building these local initiatives. I think the first part is like, at community level, and this is something which we can actually be actively promoting: prevent school dropout and strengthen referral systems, expand and strengthen school safety program. And I think these are the example, possibly MIT can actually be really looking at the schools in Pune districts or in the neighboring districts, like, and really look at strengthen the school safety programs. Standardized psychosocial support as community and specialized services. How do we really train the MITians to really reach out the psychosocial support which is necessary? And Swadeem, I'm talking about the breakdown of families into nuclear families and the kind of increased violence and things that are happening. How do we really look at strengthening the health system, working and making sure there is an effective means of reach there, and ensure adequate COVID prevention and protection? I'm not only talking about COVID, but any disaster. How do we really increase that? How do we make child protection part of the school health program, long-term interventions? How do we really make it happen? And in social policy, RDPR, how do we look at the social protection schemes, pension schemes, scholarship to reach to the most vulnerable? How do we build evidence? And how do we create that data set which is necessary for necessary state action? And I think the Panchayat Raj bodies, the local bodies, how do we strengthen them and work with this is something which is very critical. And when we are looking at DRR and Disaster Management Institute also advocate for inclusion of child protection as an emergency service, because I think CCRDR, Professor Sandosh was so clear that it is from his personal experience that he's realized the necessity for child-centered action and child protection, violence, exploitation, trafficking issues. really talked about all that. And therefore, how do we build these capacities and work forward is something which is very important. How do we look at the community structures? How do we use them to end child marriage and violence against children? How do we communities take oaths to make sure that they do not have anything to really and make sure that social and behavior change happens and you get champions against child marriage and to end violence against children. And we really need to be creating that evidence. And I think Ending Violence International Year of the Child is coming up next year. So for elimination of child labor, year for the elimination of child labor is 2021. How do we really capitalize on this as an education institution, as a disaster management institute? How do we really rehash our interventions to make sure that we are part of this? And I think to be more critical, how do we really look at what is the possibility of building on the ability of the youth? And I think in ending violence, we really need to be able to create the conversation and create that space for children to be part of this process of listening, use these helplines, reach out to people, create that safe environment at community level, in education institutions and everywhere. And how do we really coach children to be self-protecting? How do they know how to speak out? How are they able to say no to violence? Gender-based violence, how can they say no to it? How do we empower them to speak out and to come together and be actually, how do we make them informed that violence, abuse, and deprivations do increase in emergency situations? How do we really help them to seek counseling and protection? I think the whole dimension of working, and the next two speakers are specialists in dealing with the whole dimension of health seeking behavior, support seeking behavior in terms of abuse exploitation, and I'm sure they will be dealing with this. But let me conclude with the focus of building on local initiative. Prime Minister's 10-point agenda on disaster risk reduction, point 8 talks about building local initiatives and capacities. And as MITians, as students and people who are committed to making a difference in the lives of children and protecting children, COVID gives us the best of opportunities. The current scenario, I always tell people, if World War I and II gave us the League of Nations and the United Nations as a response and as a desire to build peace, there is this great opportunity of a pandemic, which was much more devastating than World War I and II. It has impacted the whole world differently. And India has a chance to be a world leader in creating a response, a system which can be more powerful and more demanding than that of the United Nations. And I believe that it is going to be the youth, the students of MIT and similar institutions who can really be those change makers, who can create a world order which is completely different and able to make an impact on the lives of children. And it is this challenge of making it happen, protecting every child, making child rights a reality, and making sure that we together, not as an education institution alone, not as disaster management institute alone, but all of us together, collectively, come together and create a world order which would respond to violence, abuse, and neglect of children in a manner which is unprecedented. And the challenge of the pandemic, the opportunity that it is giving to the youngsters, to the youth, to create that space, that solution. Let that be our challenge, and let us make sure that we make that happen. And all the very best, and thank you so much. Yes. No.
Thank you, Mr. Soni sir, for making an elaborative presentation on protecting children from violence, exploitation, and abuse. And you have shared about the priority areas and ending violence against children. Thank you so much, sir. As of now, we are not having any questions. I request all the participants, if you are having any questions related to this session, you are most welcome. Kindly post in chat box. I'm repeating, if you have any questions, you can keep it in the chat box. At the end of second session, we will be, Mr. Soni Charge will answer all your questions. Thank you so much, sir. We'll move on to the next presentation.
Please.
Now it's my pleasure to invite Dr. Veena. Dr. Veena comes to us with a holistic background. She has been practicing counseling psychologist over 10 years. She is a trained homeopath and she integrates her extensive clinical practice into psychotherapy. Veena earned her MSc in psychology, MSc in counseling psychotherapy, and in currently pursuing MSc counseling and family therapy program. She has been associated as assistant professor of psychology for physiotherapy students and other postgraduate students in Tamil Nadu Open University for the past 7 years. Over to you, ma'am. I'm just making you as a presenter so that you can share your screen now.
Okay, sir. Thank you so much.
Yes, ma'am. Now you are the presenter, please. In the bottom, there are 4 or 5 icons. The third one is share. By clicking that, you can share your screen. Dr. Veena, ma'am, you need any help?
Sir, once I'm trying to share.
Yeah, please, please. Minimize your Cisco WebEx, open your PPT, and again in the bottom there are the third icon is share. By clicking that, you can share your PPT.
Sir, I'm having a connectivity issue. I've sent the PPT to Balu, sir.
You are sending to me right now? Okay, okay, it's already there. Just a minute, ma'am, I'll...
Good afternoon, everyone. Today's my topic would be on child sexual abuse and its psychological impact and also how we could prevent this. The previous speakers have emphasized more on various types of abuses, and I want to pertain myself to child sexual abuse. Can we have the slide share, sir? So when it comes to child sexual abuse, it is a characteristic dominant position of an adult or an adolescent that will allow him or her to force or coerce a child into sexual activity. Mostly we think only an adult will be the one, the perpetuator, or he is the one who might sexually abuse a child. It need not always be an adult, it can be an adolescent as well. So there will be two types of sexual abuses. One will be the contact abuse and the non-contact abuse. Let us see what are the contact abuse. The next slide, sir. So the contact abuse will be either rape or attempted rape or fondling, that is touching the sexual organs, masturbation, orogenital contact or digital penetration or vaginal or anal intercourse, or forcing the child into prostitution. Whenever there is any physical contact with the child as such, this is known as contact abuse. When there are certain other scenarios where the child is subjected to sexual abuse without any physical contact, and those would be the next slide, sir. Yes, speaking obscene or explicit language, using sexual lewd comments, or exposing genitals to the child, forcing the child to look at the genital parts, or trying to show the nipples to the child, or voyeurism or child pornography, where the child is subjected to watch pornography forcefully. This has a huge impact on their psychological and emotional well-being. So these scenarios are also considered as child sexual abuse. It's not only when the child is physically subjected to abuse, even emotionally, or when he's psychologically he is subjected to such sort of scenarios. This is known as child sexual abuse, and this is a non-contact abuse. When we look at the statistics, the next slide, sir. 53.22% of children are exposed, among which 52%, 94% are boys, and 47.06% are girls. We always have a myth that no, the child sexual happens only to the female child. It's not like that. Even boys undergo child sexual abuses, and also highest incidences are from Andhra Pradesh, Assam, Bihar, and Delhi. And also 21.9% of severe form of sexual abuses have been happening, and 5.69% of sexual assaults have been happening. And when we look, like 1 in 5 children are subjected to child sexual abuse during this pandemic. That is the recent survey, according to the National Crime Record Bureau, NCRB. The next, who are the vulnerable groups? When we look at who are the children that get subjected to child sexual abuse, it could be, we could see children on street, and children who are working in factories, and institutionalized children, and also children who are mentally retarded, children who have parents who are alcoholic. Sometimes the father under the influence of alcohol will sexually abuse either his son or daughter. There are incidences that are been happening, and also children of parents who are under the influence of substance abuse like opioids, ganja, nicotine, the other forms of substances. When we look at what are the warning signs, usually there will be physical as well as psychological signs which we have to look in for. The physical signs will be pain, itching, or burning in the genital area. The child will be complaining to the parents that there is something that is like a pricking, or there is some sort of feeling he or she is having in the genital area. There will be bleeding or bruise, and also swelling of the genital area. Frequent urination or urinary tract infections are quite common, and also there will be difficulty in walking or sitting. The child will be complaining that she is not able to sit, or she is not able to walk. There is a sort of pain in the genital region. There is something, she is feeling discomfort, she is feeling some sort of uneasiness. So parents have to looking into that, and really get probe the child in a very soft manner. Once the child says, the parents have to be very understanding, and also while probing also, there are a few methods which the parents or the teachers have to really follow up. there could be signs of blood stains in the undergarments, and mostly in the recent scenarios, we have seen the high rise of teen pregnancies and also high rise of sexually transmitted diseases under the age of 14 years. When we look at the psychological symptoms, there will be fear, anxiety. The next slide, sir. Fear, anxiety, guilt, depression, and social withdrawal. People who are subjected, I mean, children who are subjected to child sexual abuse will have undue fear. They will be like socially withdrawn. They will not go out and play with their peers. They will be confined to a room. They don't want to get out. They don't want to involve in social gatherings. They don't want to mingle with family members. So there will be a sort of guilt. They will take the guilt upon themselves only because of their behavior or only because of them. They have been subjected to child sexual abuse. And also there will be decreased academic performance. They'll not be able to concentrate on their work. They'll not be able to concentrate on their studies. And also there will be a lot of dropouts from the schools. This will also lead to a lot of eating disorders like bulimia, like obesity. The child keeps on binge eating. The child keeps on eating. It doesn't want to because the child doesn't know how to cope with this, and these eating disorders, they think they take them as coping mechanisms. And also the child really want to subject itself to some sort of physical harm or some sort of wants to really get out of that, doesn't know how to come out of these things. And eating disorders will be one of the forms of coping mechanisms. And also there will be hostility or aggression. There will be a lot of mood swings. The child is sometimes a little bit aggressive, a little bit withdrawn. At times, the child is not able to express or channelize his or her emotions. And if sometimes the child might attempt suicide and also self-mutilations, wherein the child could cause a physical harm to self, either by cutting hands or doing self-mutilations. And also there will be certain inappropriate sexual behaviors in the child as well. There will be some sort of regressive behaviors wherein the child will be like acting a little bit childish. Even the adolescent child will be acting in a very regressive manner. The next slide, sir. A few other psychological impacts would be shrinking from contacts. The child doesn't want others to touch her. The child who had been very extrovert or very sociable with other people, suddenly with be withdrawing herself or himself, and doesn't want others to touch her or come near to the near vicinity as well. And also there will be fear of things that are associated with abuse. It could be color, it could be any sort of smell, it could be any object which the child would have placed itself and confined it in its mind. It would have just focused during the abuse. It would have focused on a particular object or smell. And whenever any smell that is which is at the site of the abuse, whenever that smell, sight or vision, color or anything that is pertinent to that abuse scenario occurs, the child will feel very insecure, will be in fear, and also the child will throw tantrum tantrums, and it doesn't want to relive those moments. And also there will be bipolar disorder sort of symptoms, wherein the child will be feeling so depressed, and it will be altered with high maniac mood swings as well. And also certain children might get into addiction of alcohol or substance abuse just to forget about these incidences. And also the child will be suffering with lot of flashbacks. The incident keeps on coming, and it will be a lot of trauma for the child. And also the child will be having a lot of nightmares and insomnia. So there will be a lot of disturbed sleep. The child will be not in a position to sleep properly, and this will be continuing for days together. And ultimately, when the child is not able to cope with this abuse, it will be forced to undergo post-traumatic stress. The next slide, sir. So as professionals, what help could we do? When we look at the counseling support, it could be in 3 stages. First stage would be primary. In that primary stage, it is like creating awareness to public through various medias like social media or documentaries or short films, wherein the whole public could be enlightened or educated upon the emphasis of child sexual abuse, and who are the groups who get abused, and what are the things that are considered to be an sexual abuse. So this is like educating the people on a larger spectrum. The secondary counseling support would be like educating kids. It is very essential, like Sonu Kuti sir and also Swati ma'am have emphasized on educating children about the abuses. So there is a very much need for sex education in the curriculum, so that the child is taught about sexual uh, abuses and also about sex in a proper way. Because what happens is, most of the times the child, out of curiosity, most of the adolescents, they really don't know much about sex, because we belong to a country where Vatsayana has given Kama Sutra to the entire world, but still we have the taboo of speaking about sex in our families. In our cultural context, it is a taboo to speak about sex. Still, Kama Sutra doesn't teach only about the sexual positions, it also teaches how the sex should not be abused as well. If many doesn't know, this is what is about Kama Sutra. But we never discuss these things with our kids. None of the parents will find it that the child should know what is good and what is bad and what is it about sexual education. So I think now is the time for reforms and policy makings, and also to make this sex education as a curriculum in the mainstream education as well. So like this, we can help the child to know about what is safe touch and unsafe touch. Most of us will emphasize upon the good touch and bad touch. It's not about the touch is not good or bad. It's not like that. You have to tell the child whether the touch is safe or unsafe for her, whether it is physically safe or psychologically safe or unsafe. Because like I told you, the sexual abuse is not only with the physical thing, it also has a huge impact on your emotional and mental well-being as well. So the tertiary counseling will be like to get the child who underwent the sexual abuse and give him one-on-one, him or her one-on-one counseling, and help them to overcome from this trauma. The next slide, sir. So what will be the counseling and support from professionals will be like? We have to emphasize abuse is not a child's fault. As soon as the child comes and complains to either the parent or teacher, they will just put it off like saying, no, you don't know anything. You just shut your mouth. Don't say anything. What do you know about it? Always listen to the child, what the child is saying. Children, no, as such, will not like imagine things and come and say to us. Always the key points for good parenting is accountability and acceptability, unavailability. You have to always be there for your kid whenever the kid needs you. As a parent, it is your responsibility to always be there for the child. But because most of us are like both the parents are working, it is not that much possible for the child parent to be always at home. So nowadays the incidences of child sexual abuses have increased because the parents don't stay at home and the child is staying alone, and there will be a lot of chances for this child sexual abuses that will be happening. And when we look at, most of the perpetuators will be the persons who are known to the family. It could be either the family members or the persons who are very much close to the family as such. When the child comes and complains something, the child will be saying to the parent, either mother or father, that please don't go to office, stay with me at home. Whenever the child says these words, just give a moment and think why the child is saying so, why the child doesn't want you to go to office. just probe it a little bit and know what are the facts, and also always help the child to get rid of the shame and guilt. Never blame the child. You were like that. You were like this. You have dressed up like this. That's the reason you have garnered that attention. Never, never blame the child for the sexual abuse. Please help the child to get rid of the shame and guilt, and also make the child feel confident. Sometimes what happens is we always think like the child is subjected to sexual abuse. Oh my God, what has happened to the family honor? How this child is going to be accepted in the society? How this child is going to be accepted in the family? Please don't subject your child to such sort of treatment. It will really break the child. So make the child feel confident. Please, the family members have to be very, very, understanding that with no fault of the child underwent the abuse. And many a times it is so pathetic that the child doesn't know that it has underwent abuse as well. Imagine the plight of the child. Okay? And also help to rebuild the child's self-esteem. Assist the child to feel safe and secured and accepted. Okay, help child look into the future. Don't dwell on the past incident. It has happened to you. What are we going to do? Never try to repeat the incidents again and again. And also, counseling for the entire family should be taken. Not only for the child, it also even the family will be in trauma. The family is also in a situation where they are not able to accept the incidents, or even the entire family will be undergoing trauma. So family counseling will be very helpful in such scenarios. The next slide, sir. So there are some don'ts which we have to keep in mind. Never pressure the child to talk about abuse while probing to know what has happened or to collect the information. And also while you're going, you file an FIR, we have to make sure that the police or the officials don't come in their uniform so that they don't frighten the child. And it is mandatory also, and in the protocols as well, that the officials don't come in their uniform. They come in this civil dress, and they try to talk to the child. And also never blame the child for the incident, or never panic or overreact in front of the child. And we have to keep in mind that when the child says such so and so perpetrator or so and so member has abused me, never confront the child in front of the offender, so that no, sometimes the child will become more afraid. Never confront the child in front of the offender, or and vice versa also. If you know that this is the person who has like abused the child, never confront him in front of the child as well, because sometimes the child will be feeling more traumatic. And also never make the child repeat the story again and again. Already the child underwent some sort of trauma. When you make her revisit the incident, it will be very traumatic. Imagine the grievance will be more. The next, these are the don'ts we have to keep in mind. So what are the rules that have to be taught for child? Like I said, it is about the safe and unsafe touch. Say to unsafe touch, teach personal safety rules like no, run and tell. Always the consent. Teach your child to say no. That will really help. So, and also say no, run and tell. So whenever such sort of any person like comes and tries to abuse your child, tell your child that she can come to you and talk about it. So don't put it off, or don't try to brush it off like saying I'm very busy with my office work. You go and tell to someone else, or you go and talk to your mother. See, as much as it's a mother's responsibility, even fathers do have the responsibility of parenting. Okay, so when the child comes, give that comfort zone, give that confidence to your child that the child will come, we can come and can openly share anything that happens to her or him with the parent. How it could be done? By spending quality time. quality time. Spend at least 10 minutes of your 24 hours with the child. Ask them like how their day was, what has happened, what did they do with their friends. This is how a parenting should be. Though you are held up with your office work, though you are held up with your projects, submissions, with your deadlines, everything, 10 minutes would really do to take care of your children. Spend that time, and that too quality time. Switch off your mobile phones and give undivided attention to your kid. And also for parents and caretakers, you have to know to recognize that the child has been abused, because there will be certain signs and symptoms. As a mother, as a parent, you are regularly how your child will behave, and what is the difference you could see in your child. Whenever there is any minor difference in their regular routines, think about it, and also help the child talk, and also don't make the child to hurry up. Give its own space, because children will need that time to open up. Don't like say, come on, I don't have time. Come on, tell what has happened. What has happened? Said next, I don't have time. What has happened? Did he touch here? Did he touch there? Never hurry up. Help the child to talk on its own. Allow the child to have her own time. Let her or him, whoever it is, open on his own. And also help the child to seek professional support and help. There are a lot of helplines for the child. Educate your children about 1098, that is the child helpline, so that in case if any incidences are happening, the child could really seek the support. The next slide, sir. So, how to handle abused children? Listen and believe the child. Respect the child's privacy. So, if such sort of incidents happens, what happens is, there, in case if it gets into the immediate family or the other family, please don't try to spread the news, and please don't try to what to say intrude the child's privacy. And also always answer the child's question, be it any question. Sometimes they, out of curiosity, the children will be asking about sexual organs. Okay, sexual organs. But what we do is, we always try to put it in a different manner. We don't teach what the sexual organs are called. I'll tell you a small incident. Once what happened is, a child was telling to the teacher like, the caretaker has licked my cookie. This is what the child told the teacher. The caretaker has licked my cookie. The teacher thought it was a regular cookie that is eaten, and said, okay, you can ask your caretaker that he can give she can give you another cookie. And what happened is, after a few days, the mother has written to the teacher like, my child has got a rash near the cookie. So she is having a little bit of fever. That's the reason she is not able to attend the school. There the mother meant cookie is nothing but the breast or nipple. So this is what, and the child has been telling to the teacher, the caregiver has been licking my cookie. So this is how, teach proper words or proper parts to your child, so that they don't get confused, and whenever such incidences happen, they will come and report to you. Also, give positive message. Report the abuse. Whenever such scenarios happen, never keep mum. Always report the abuse, so that such incidences don't happen to other children. Get rid of the pain, shame, and guilt, both for parents as well as for the kid as well. Rebuild the self-esteem and confidence. Make the child feel safe and secure, and also counsel the entire family. This is how you handle an abused child. The next slide, sir. So psychological assessments, you have to make the child talk, and there are a few projective tests where we ask the child to draw or tell a story. There are ink block tests. which will be useful for uncovering the unconscious things that have happened. Why drawing or tell a story? I'll tell an incident. Once when a child was asked to draw, she drew a picture of a man, and she started to stab with the pen the genital area of the man. When the counselor probed more about it, then the child said, "This is bad, this is bad, I don't like." Then the further probing by the counselor revealed that the child was sexually abused by a man. So this is how you come to know, this is how you can assess the child underwent abuse. There will be play therapies, there will be sand therapy as well to overcome these abuses. The next slide will show emphasize on more about the therapies. The next slide, sir. So psychological treatment will be like counseling the child, the family, and also the psychotherapies would be the behavior modification, and a few techniques like the cognitive behavior therapy, the REBT, which is the rational emotive behavioral therapy, and also the thought blocking. And I told you about the post-traumatic stress syndrome. So for that, we have a special therapy known as EMDR, rapid eye movement desensitization. This is the therapy we usually use to for the child to come out of that traumatic incident. So these will be the psychological treatments that can be given for the child. Before this, the education, the awareness in the society, and breaking the stigma will be very, very helpful. The next slide, sir. So some of the myths are like the child sexual abuse will be committed by the strangers. Like I told you, not the strangers, the persons who are very close to the family, or the family members, family relations. These people are also the perpetuators. The other myth is only men sexually abused. Not like that. There are a few female women also who will sexually abuse either boys or girls. So gender has nothing to do with this abuse. And also there are certain myths in rural areas, or in very, very remote places where they have this feeling like sex with minor increases the virility, or sex with minor will give you lot of prosperity, long life. Such sort of myths are there still prevailing in the remote and rural areas of our country. So we have to eradicate such myths, and we have to really educate people about child sexual abuse. And also there is a myth that a child is vivid and imaginative. Please never brush off whenever a child comes to you and complains about such sort of incidents. And also the other myth is decent child don't get abused. Whatever the child is, however decent or whatever it is, any child is prone to child sexual abuse. Okay, so these are the myths we have to really look into, and we have to really consider. The next slide, sir. So the laws, IPC 376 is for crime or rape, 377 for unnatural offences, 354 for outraging modesty. Even children do have the modesty. So 506 for obscene gestures, 1956 the Traffic Prevention Act was there, and 205 we had the offences against children bill, and recently 2012 we had the POSCO law, which was on prevention on child sexual abuse. The next one, sir. The recent is the POSCO Act. So some of the organizations that work for child sexual abuse are UN and UNICEF. We have Sonukuti George sir, who is a part of UNICEF as well. And when we look at India, there is a Child Sexual Abuse Committee, Arpan Rahi, and in Chennai we have Tulir, which does a lot of work with child sexual victims. So these are the organizations and committees that really work into the child sexual abuse. The next one, sir. So I really want to conclude like childhood is very, very important in the developmental stage of human life, because it is like a foundation. If the foundation is good, then definitely the individual will be prospering into an healthy, both physically and mentally healthy human being. And today's children are tomorrow's citizen, and childhood is supposed to be happy. And if you can't remember yours with any happiness, what hope you have later when life starts handing you fresh grief? So I want to conclude and thank you one and all for giving me this opportunity to address on child sexual abuse.
Thank you, Dr. Veena. It was a wonderful presentation. You have discussed about contact abuse and non-contact abuse, and the physical warning signs of abused child and psychological warning signs of abused child, and the most vulnerable group of sexual abuse. And you also talked about handling abused child and safe touch and unsafe touch. So it was an interesting presentation. With this, I think now we can move to the question answer session. There is some questions related to your presentation also. Let me read one by one. There is a general question: how can we as a youth of nation contribute towards fighting sexual abuse in differently abled children? Any one of you can answer among the panelists. Sir, would you like to answer this question?
I think, yeah, Veena will certainly come in. I think it's see, the most important dimension on any abuse is the fact that we need to be conscious of the fact that how are these abuses happening. And if we are aware, and I think Veena ma'am was critically talking about what is the self-protection mechanism, but it is like there are segments of people who are getting abused, especially the differently abled people, people with disabilities are getting abused to a very large extent. And therefore, as youth, I think one is creating this awareness and right lingo, the right language, which Veena was talking so much about the necessity to have the right lingo. How do we really use the platforms to promote that and make children and parents use the right words for to describe the private parts? And I think it is very important that we are able to be doing that as the first thing. Second is the self-awareness, and how do we ourselves protect from such abuses is actually a very important step in our direction. And I think the whole framing of violence against children as a much larger, I mean, I would say this is the 100th year of freedom movement in terms of the non-violence movement. How do we really, maybe MIT take this on and say, like, violence is like, non-violence is part of India, and the whole protection from abuse exploitation is part of non-violence, and this is the ahimsa in its totality is the way ahead. And I think this consciousness and how do we really work on it is critical. Yeah, that's from me. I think there are two questions. One was on the NSS one also, and about the non-competitive exams which had come up earlier in the chat as questions. And I think if you really go through the NSS objective, why is it that actually the objective is to understand community and to identify needs and problems and create solutions working with communities. And it is all in the definition. How do we really look at these definitions from a very narrow, only physical labor situation to a position that we take differently in terms of understanding the extent of violence? If you really looked at the message from Professor Meera, and also if you really look at 30% of the children are part of the, and if you really look at the national flagship programs of which talks about drug abuse, which talks about HIV/AIDS. And in such situations, if you really look at violence and sexual abuse or exploitation of children, this becomes very critical. And therefore, for me, it is natural that NSS needs to be using those explanations of working on drug abuse and others, really look forward to looking at that. And non-competitive exams, games, I think the whole education process today is centered around making one the winner. And how do we really look at working together as a modality, as a way of life? And I think that is the solution, not just looking at self and looking at collective work. I mean, like, you look at in any industry, when you get employment, it is always looked at team performance. You are never judged for your individual performance. It is everywhere you have to work as teams. And everywhere we have taught competitiveness in terms of putting others down and being one. How do we really make sure the others and collectively grow? And that is a very, very critical dimension of collective work. And I think this is very important, that we take these issues forward in that spirit and in that essence. And therefore, non-violence as the Indian contribution to this whole world. And in this new phase of collaborative work and working together and moving forward, I think we do have an opportunity ahead of us to really show the way to the world. Thank you. Over to Veena ma'am.
Thank you so much. Veena ma'am, for you, there are two more questions, I think.
Yes, sir. I have seen how 377 is related to child sexual abuse. Sir, even now 377 is very much prevailing for sexual act with minors and also non-consensual sex acts. So that's the reason I have mentioned about IPC 377. And the next one is how to train parents about POSCO Act. They are not ready to file FIR against. Like I told you, first and foremost, to really curb this child sexual abuse is to create lot of awareness and break the stigma. And also the thing would be like, if the parents are not ready, I mean, I think a POSCO Act, any person who in the interest of the child can go and file the FIR. I think there is there should be such sort of facility for that, in concern of the child. Any person who is even not a family member can. And also there are a lot of NGOs who are working. Probably you can approach these NGOs and they could come in and take the action. So yes. What about broken family system? Secondly, the child himself become the manager of home as father. Yes. Yes, sir. Like I told you, the family dynamics and family system plays a crucial part. Sometimes what happens is this broken family, the children of this broken family are the most vulnerable groups. And I think this question, sir, Krishnadas, sir, is it with the child sexual abuse or as such any sort of abuse? Because the child becomes the manager of the father. I think George sir can throw much light on this question.
I see. I think broken families and when children are themselves breadwinners, and I think it's like, in some situations they are breadwinners, but I think this is more the question. I do not know whether it is only on violence and exploitation, but generally on child-headed families and situations that is arising, which is part of an increasing numbers in this country. And I think it is the understanding of the legislation, basically the Protection of Children from Sexual Offences Act. POCSO Act is a very powerful legislation in terms of the kind of punishments that are meted out under the Act. is unprecedented. I think it's the way the response of the state in terms of creating this fear of abuse. I do not know whether that's the one which will work, but I think simultaneously the education of children, like giving the right lingo, making them understand this is equally important. And also, I think where we face, I mean, like, for example, the best education material on child sexual abuse and how do we educate smaller children. I think the first film came from Pune-based activists. The whole education process, how do you give that, how do you talk about safety, how do we really create that awareness, and materials from Childline and all are there. I think the whole creation of awareness, to create awareness, I think there needs to be an education for ourselves. How much are we open to de-learn, understand how do you really look at these processes? And I think that becomes very important. As I told you, like, 2 decades ago, if MIT was, I'll talk, this was Asia Pacific Regional Conference on Education for Human Rights. And this was in 1999. And I think it's like, you are talking about such futuristic thinking, and institutes of this nature needs to play that role. How do we make these legislations and these issues a reality in today's context? How do we really make sure that we are able to be giving the right language to children to explain what is happening to them and what is it that they are trying to tell parents? How do we give that education to parents and use any methodology? And I think this COVID scenario right now, we have so much of opened up our openness to look at online modalities of learning, and it becomes cost effective, it becomes able to reach. We can create capsules, you can create small videos, you can give things out which would make the difference. And therefore, the communication, students learning communication might putting a project on something like this. For example, child sexual abuse and how to protect yourself. How can parents intervene? Make everything in a minute or 2-minute capsules which can actually go out, and therefore that itself becomes a learning process and a collective action where the transformation happens to ourselves and we are able to be change makers as well. And that is the challenge of NSS, that is the challenge of NCC, and organizations, I think, can make that happen. Thank you so much.
True that. I just want to add one more point, sir. See, the educational institutions have to focus more on the empowering the kids with life skills more than the academics. We are more academic oriented rather than shaping up the children and their future. Academics are only a part of our life. Our life itself is not full of academics. There is something beyond that. Okay, so when you teach child about life skills, you will be teaching them about compassion, about empathy, about problem solving, decision making, how to deal with crises, how to deal with your emotions and stress, and also the critical and creative thinkings. All these things is what will make you an individual. Your academics are only a part, it's not your identity. So please, the educational institutions have to be very stubborn, that they have to give kids who are both physically, psychologically, mentally very strong for this society. Only when we have such reforms in our educational system, nothing could be done.
Thank you, Dr. Veena. Professor Santosh Kumar, sir, would you like to intervene here? Professor Santosh Kumar, sir, would you like to add any points? There is one last question to Sony Chad, sir. The UN age for child labor is 18 years, and in India it is 14 years. Do you think there is a need for revision? Also, under the discuss of family business, child labor still prevails in our country. How are these being addressed?
Good. Thank you so much. This is one critical area the definition of a child under UNCRC and in many Indian legislations is 18. And the necessity of bringing 14 to 18 in the realms of life skill education, vocational training, and being prepared for the life is one part of it, and the new amendment to the Child Labor Act and the term adolescent is brought into the legislation. So this is an area which requires a lot more of thinking and working together. And I think the whole concept of vocational training, vocational education, and family businesses and things like that in India is slightly different from across the globe. So how do we really see this in that realm and look at the ability of the child to grow to its full potential, and nothing becomes a hindrance to its growth and education becomes the point of view. And any legislation, for example, child marriage, now there is a proposition that you change the age of girls from 18 to 21, and that is under discussion. So a lot of these changes, we really need to be conscious of the overall impact on the society. Is it going to be for better interest of the child, or it's going to give us more damage? For example, same thing about 16 to 18 children in conflict with law, a different treatment, and how do we see it as heinous crimes, and then the way that we treat the children. So recently, the discussion and debate on these areas are emerging. The position is that up to 18 years of age, the child should have the freedom to grow to its full potential, and therefore no labor that would hinder its growth to its full potential should be enforced, and therefore that requires that attention which is needed. And I think it is rightful that these questions get asked and we start discussing on this one in such platform, so that we are able to really take these issues forward. Thank you so much for that question. It is a very, very relevant and a live question.
Yeah. Thank you, Chad sir. Now I invite Professor Santosh Kumar sir to deliver a concluding remarks. Over to you, sir.
Thank you, Dr. Balu. And I don't think at this stage I have to say anything.
Okay.
Delegates, all the speakers have given a very good insight. I was listening to Mr. George also, and the way he given the picture, I'm really delighted to hear him. And Madam Swati Karachate also mentioned in the beginning in the keynote address, many issues were brought. Dr. Veena also brought psychosocial, and she gave very good examples from the real life story, that how and what kind of a language to be told. Dr. Surender also mentioned in the beginning that why this particular program is important, and one institution should meet with other institution in partnership. Overall, what I would say that in this scenario, I would just like to say that why not be a kind of a more cooperative way of working, and we should strengthen our hands with the CDRR to UNICEF to institution like this, which we have organizing. To inform you also that NIDM has created this Association of Indian Universities for the disaster risk reduction. If you go on our website, you will find there is no member member fee charges for that. You can become the members, and we are going into different issues also along with the children issues. What we are saying for specifically is kindly strengthen the CCDRR initiatives with your all wisdom and your experience, and strengthen these issues, because we are making investment in future generation. Had it been our childhood, these would have been told, probably we would have been protecting ourselves differently. Since this was not there, even the pandemic, our grandfather or even father did not mention even once that what is pandemic And if once we face that, how you cover your nose and sanitize yourself and make the social distancing. So that was the language missing gap. So this generation which has faced, we should anticipate some more complex situation and try to train our future generation so that they can take themselves take care of themselves, and also they can help us, like when we were be really very old and they are there to they become adult after 10 years or 5 years of time. So the idea is to that future generation can protect themselves and can also have the responsibility of training their coming generations, future generations, and the older generation which we would be existing. So that kind of approach. So idea is to whatever we are learning, that should go into a kind of intrigue design of our curriculum, our mindset. That entire thing is about the behavioral change. And if we do not change and we keep neglecting our children, seeing that they are the smaller and vulnerable, probably we will not be able to achieve. So provide them the opportunity, provide them the space where they can speak out, and we with our own experience we can share with them, and in a much more partnership, because one institution cannot do much. They just move out, even not an inch in India, but collectively, of course, we can have a kind of a thing that yes, we can do something. So I extend my heartfelt thanks to all of you, and especially the panelists who all were there and shared their wisdoms, and wonderful questions came. To Dr. Balu, I would say that whatever the written recommendations which are coming, or the people have suggested, the panelists have suggested, put it in the framework, and our next year plan, which is coming up now, we are preparing for the next calendar year's plan, so that we can take up for the forward and see that how the role of these institutions can also be ensured in our own program. And in their program, how the support of CCDRR can be brought in. So both ways we can strengthen each other, and we will have much more synergy. So idea, one thing which has come up, new knowledge, new idea, new challenges, and the DRR perspective. Thank you very much to all of you.
Thank you, sir. Definitely, I'll document our suggestions came in the chat box and given by the panelists. Thank you, sir. Now it's time to end up our program. So on behalf of Child-Centric Disaster Risk Reduction Center and National Institute of Disaster Management, I would like to extend my sincere gratitude to Major General Manoj Kumar Bindal, sir, Executive Director, NIDM, and Professor Swati, Executive Director, Trustee, Secretary, MIT Group of Institutions, for patroning this program. And I also extend my sincere gratitude to Professor Santosh Kumar, sir, Professor and Head CCDRR and GIDRR, for his wonderful guidance to conduct this program. And my sincere thanks goes to Mr. Sonikuti Church, sir, who is a child protection specialist, for giving his valuable time in this program. And I also thank Dr. Veena Pillai for joining with us in a very short time. Actually, Dr. Suresh Kumar was supposed to join here, but due to some emergency in his family, he was unable to join. So thanks for joining us with Dr. Veena Pillai in the short time. I also thank Dr. Kumar Raka and Dr. Surendra, Principal of MIT St. Billet College, for being convener of this program. So once again, my sincere thanks to all the dignitaries and the participants who was actively participated in this program. Thank you so much to everyone. Thank you.
Thank you. Thank you.
Thank you so much, sir.
Thank
Thank you, ma'am.
Thank you.
Thank you, Surendra, sir, for successful completion of the program.
Thank you, sir. Thank you, sir. Thank you so much.
Sorry, there was some network issue from my side, so
No problem,
initially
sir. No problem.
I faced some challenges.
No problem, sir. Congratulations, sir.
Look, yeah, thank you. Looking forward to your collaboration for a long time. We are also planning to have some 3 days training program. Definitely, we will be in touch with you.
Definitely, sir. Thank you so much.
Yeah, thank you.